Now this is a very interested CT scan of the abdomen. You can simply pause the video and you can try to find out where is the problem. Now in this, when we zoom in, what we can see, first I'll let you know, this is liver, this is spleen. This is an easy approach and this is a better approach so that you can try to find out and try to connect all the dots. So this is left side, this is right side, this is always the same way. This is left and this is right side of the body. So on the right we have liver, so this is liver, this is spleen. And liver and spleen, they have same attenuation. They look almost same. Their hyperdensities, their ecotexture is almost the same. Now, next thing is just in front of spleen, what you'll get is stomach, and you can very easily diagnose it. This is presence of fluid, and fluid has this darkish or blackish intensity or hyperdensity, and this is air. This is dark black in color, so that is air. So this is stomach. This is the stomach air in the stomach. This is all stomach air. This is stomach air, this is stomach air, this is stomach air, this is stomach air. So this is all stomach and this is all liquid or fluid in this stomach. So we have diagnosed or we have found this spleen, this is liver. So what we need to see always is whether there is any lesion in the spleen, the lesion in the stomach or lesion in the liver. How do we come to know? Just trace their borders and see the internal structures whether they are uniform or not. So see, this liver is all uniform, the borders are pretty clear, crystal clear, there is no any inflammation. In spleen also this is pretty good, the borders are clean cut. Here also the spleen, the borders are pretty clean cut and there is no any lesion inside, there is no any lesion inside, so they look all okay. This is stomach. So when you go behind them, what you can see, the next thing which we should see is the intestine. The intestine very easy to find out. These will be round tubular structures. This is all part of intestine only. This is collapsed because there is no much food in it. And see, this is also intestine. This dot, the white black dot, these are air. This is air. This is because of the digestion of the food, and some part of this is food. This whitish patches, this is all food. So this is food, this is air, so this is intestine. And as this is basically on the right side, and this the lumen is more of a large. We know that on the right side we have ascending colon. So this is ascending colon. The next thing is we will try to find out the kidneys. So where are the kidneys? Kidneys will be two in the number. You can find out here. So this is first kidney, this is left kidney, and this is right kidney. This is left and this is right. Now when we see, you have to see the size of both the kidneys and the borders of the both the kidneys. They should be smooth, round. So see, this is the left kidney. This is the border, which is very crystal clear, very smooth. And this is the renal pelvis. This is the collecting system, and through which the ureter arises. The same thing on this side. This is the kidney. The kidney is perfectly smooth, round, and this is the pelvis. This is the drainage system of the kidney. Here also, this is kidney. The drainage system is not that much apparent, so it's okay. Now you compare this left kidney with the right kidney. See, right kidney, it looks much bigger. Just see, it looks around two times size the kidney, and the margins are not very crystal clear compared to left kidney. See the left kidney, the margins are so smooth. You can see very small, very smooth margins. But here, the margin is all blurry. It is like serrated. See here. The margin is not smooth. See, this is margin is not smooth. Same thing here. And here, basically, the margins are not smooth. Margins are slightly blurry. You can see there is one white line here, like this. Here, 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 here. So the kidney here also is enlarged in size. See the pelvis. It is very small, and compared to here, it is large. And why it is large? It can be large only because of the hydronephrosis. What is hydronephrosis? Kidney, and there is ureter. Normally, this ureter is very small or it is not dilated. So you will see this pelvis in its normal size. But whenever there is hydronephrosis, why could hydronephrosis occur? That can be because of stricture in the ureter. There can be stricture, there can be a stone which is impacting here, stone which is blocking the urine. So if there is stricture, if there is any mass here, if there is stone, the urine will not flow down. So urine will start accumulating. So the ureters will automatically enlarge in diameter. So automatically urine will be accumulated here, and the pelvis will dilate. What next? The kidney will dilate. There will be more and more pressure to the cortex. So, and the kidney will enlarge in size. There will be inflammation around, and there will be perinephric fat stranding. So there will be inflammation around the kidney, and this inflammation will simply put in infiltration, white linings in the fat. Where is fat? This all is fat. This all is fat. Okay, this is abdominal. This is above the abdomen fat. So around the kidney, this is all fat. This is all fat. The black structure is all fat. This is dense black. This is air, and lesser black is this fat. This is all fat. This all is fat. So you'll see white linings inside that will tell you that this is fat. So in short, what we are seeing here is the size of the kidney is enlarged. Size is more. The pelvis is enlarged, the renal pelvis is enlarged, and there is infiltration of fat around the kidney, suggesting there is some inflammation. So, this is in short a case of hydronephrosis, which is mild because the renal pelvis is barely visibly enlarged. It is not very much enlarged. It can be much more enlarged than that. So there is perinephric fat stranding, and there must be some ureteric calculi which is blocking the urinary outflow. That is the reason why the obstruction is there. So this is typical ureteric calculi causing obstruction. Now, in this particular case, the obstruction was not very well visualized. I'll upload a different video for that. This is bladder. When you come below, now this is pelvis area. This is pelvis area. This is, you can see, uh, this is pelvis area because here there is no liver, there is no kidney, there is no spleen. So we have come below that. This is bladder, and this is a part of anal canal. We must know that bladder is always anterior. Behind that, what you get is usually uterus, but as the patient was male, there is no uterus. And behind that is rectum and anal canal. So rectum will be more in size, and anus will be a small in size. So this is bladder, and you can see a small calculus here in the bladder. So this was a typical case of lower ureteric calculi as well, with mild hydronephrosis, mild perinephric fat stranding, and increased size of the kidney. So that's all. Thank you.